Dr. Jaisri Ramani is also have prescribed the spirulina 333 and all these things. And I have shown her tongue, nail and all these things. Chalo, let's, there is an emergency in the delivery. So let's conduct the first delivery. So we conducted the first delivery and then we taken every precautions to prevent excessive blood loss by a gynecological obstetric treatment. And then I feel there is no emergency. Then I understand, let's do hemoglobin in the morning when laboratory opens, and then we demand the blood transfusion from the blood bank. Then I found the hemoglobin 9.5 gram. So this condition has sparked my mind that now can we study that is a natural to prevent the to save the bottles of blood by spirulina DXN. Even the 7% lady has taken spirulina regularly since last 30 days in the last month. Can I save the bottles of blood? So this study is conducted by me from October 2008. Those women, I have made selection that those who are having 9% of hemoglobin means a woman is pregnant lady is having moderate degree of anemia. 7, 8 and 9 months of pregnancy running means last trimester when there is an excessive demand, Unmarried girls with heavy and painful periods and hemoglobin less than 9%. Elder ladies with heavy regular periods with hemoglobin less than 9% at perimenopausal age. Therapeutic requirement, I have detailed calculation and understanding of in my spirulina special presentation I have given. But here I summarize. To achieve 900 to 1200 milligram of required elemental iron, there is a need of 180 to 360 capsule of spirulina to achieve the target rise of 2 to 4% of hemoglobin. Because 1 kilogram of assorted vegetables biological value is equal to 1 gram of spirulina, and our daily balanced diet contains 10 to 12 milligram of iron of our daily requirements. So 1 capsule of spirulina provides 4 to 6 milligram of elemental iron in absorbable colloidal form. This study I have recorded like this. Serial number, name of the patient, address of the patient. Some patients are having mobile numbers also. What month of pregnancy, what EDD, expected date of delivery, on which first hemoglobin gram percent date, the date on which first hemoglobin gram percent done, that is 8.8, 9, 7.5, 8.5, 7, 8. And this second row, spirulina, cocoji. In these initial stages, I have also combined both the treatment, spirulina with allopathic iron. The second study date of hemoglobin I have done after, as a hemopoietic time duration is 4 to 6 weeks. So 4 to 6 weeks after 25 or 35 days when patient comes in follow-up, I done secondary report. So 8.8 to 10.8, 9 to 10.8, 7.5 to 9.4, 8.5 to 9. This study I have conducted of 53 patients. One of them I want to recognize that 51 number. Vanita Ben Chotelia, coming from Moa, 8 months amenorrhea, 7th December 2009 expected date of delivery. And she come to me on 7th 11 2009. Means just 30 days before from Moa, as a just when daughter comes to his parents' house. So she was having O negative blood group. I have given her spirulina 4 in the morning, 4, and then patient regularly come for follow-up last month, 25th 11 2009, 8.2, 5 December 2009, 9.5, and she delivered on 6th December without requiring any O negative bottle blood. Means spirulina does not differentiate whether you have positive blood group or negative blood group. You should have only natural food, natural blood. It does not partialate any group, positive group or negative group. So for that point of view, I would like to highlight. And here I have given not even any allopathic form of, I have given only spirulina. Aloe vera. The another products from DXN, having properties soothing, healing, moisturizing, anti-inflammatory. What the benefits we get in pregnancy? Topical use have lots of benefits. Natural healer in minor burns, protect the scarring of the skin during pregnancy. As the uterus increases in sizes, it stretches the abdomen. The fats going to rupture and there will be scar forming. And also dehydration and some sort of will be another the culminating factor for the scarring of the skin. So aloe vera will prevent the scarring of skin and prevent dryness of the skin. Morinda citrifolia, another product from DXN. Properties, also called noni, found in tropical countries, adaptogenic. Many beneficial compounds are found like amino acids to chemicals having enzymatic properties, and benefits are to balance the pH, correct the digestive system, anti-inflammatory, antihistaminic, abdominal pain reliever, and immunity booster. Because these are some sort of common problems we encounter during pregnancy. Woman comes to complain, sir, pet mein dukta hai, this much, and this much. So, Morinda citrifolia, even taken just 20 ml, single time, can be controlled or can be really benefited. Genodermati, those patients who are not affording RGGL, for that pregnant lady, I have just formulated this refreshing drink with antioxidant value, all benefits of Ganoderma lucidum, lime tea supplies vitamin C, and economical natural way to prevent complication, because 2 spirulina and 3 times a tea is a simple way to protect the to prevent the complications. Cocoa protein powder. Cocoa powder is cocoa with protein powder drink, refresher with energy booster for development of extra need of protein and vitamins and minerals for fetus and mother both. What? These are full natural products. What benefits in normal pregnancy? What in high risk pregnancy? Ganoderma, spirulina, arugula, moringa in pregnancy. In normal pregnancy, maintain the blood pressure, better nutrition, prevent complications like increased maternal blood pressure, anemia, prevention and treatment, oligohydramnios, IUGR, better immune status. To the normal pregnancy ma aa vastu na thwa de. The IUGR can be prevented, oligohydramnios prevented and treated, better immune status can be maintained, less chance of infections, and improved glucose tolerance, so no or prevent gestational diabetes. In normal pregnancy, if we consider RGGL and spirulina as a routine prescription. In high-risk pregnancy, by improving the fetal circulation, helps to manage the increased maternal blood pressure. By improving fetal circulation, helps to manage the increased blood pressure, because during high pregnancy, when there is toxemia, when there is a rise of blood pressure of the mother, there is a compromising the circulation through the fetal umbilical artery and through the blood flow to the fetus. So, fetus compromises and it gives impulses to the mother's heart. So mother heart forcefully pumps and there is a rise of blood pressure. Again there is a vasoconstriction. So minimizing the blood flow to the umbilical artery. So this cascade goes on and mother ultimately goes into hypertension. It develops edema because of hyperperfusion, hyperdynamicity of the blood flow. So, and fetus, by compromising the fetal circulation, there is a diminishing amount of liquor around the embryo, around the fetus, and ultimately fetus will not get more than 2 kg weight at the time. So this is we call that high risk pregnancy. So by improving fetal circulation, helps to manage the increased maternal blood pressures. Means, Ganoderma, by this type of which I have mentioned the effect, helps to improve the blood circulation, fetal circulation through umbilical artery. And so, fetus will be satisfied. If fetus satisfied, then it will not react with the mother's heart. So, mother's heart can be managed, mother's blood pressures can be managed, toxemia can be prevented, and oligohydramnios prevented, and we get the good nourishment heart. By this sentence, I want to explain such way. Improving fetal nourishment and weight gain of the fetus may help to maintain the liquor and prevent further oligohydramnios, which I have talked, and pregnancy can be continued up to the term or beyond 8 months for better fetal outcome. Sometimes these conditions becomes very, very severe, hypertension, oligohydramnios and IUGR. So we may have to terminate the fetus even at 32 weeks, before 30 weeks. So there will be no need to terminate before 30 weeks, and we can continue up to the beginning of the 9 months pregnancy, and we can get fetal weight more than 2 kg. Clinical benefits which I encountered in my practice is I have shown here. Treatment and prevention of anemia, better nourishment of mother and fetus by natural elements. So preeclampsia, oligohydramnios and IUGR can be prevented. In infertility, better nutrition in natural form can prevent genetic complications like neural tube defects by improving uterine blood flow, improves endometrial score and receptivity for implantations. Before infertility, for the treatment of the infertility, we also prescribe nutritional elements as a folic acid, vitamin B12 capsules and whatever these things, antioxidant capsules. Here, spirulina, all in one, gives us an RGGL for better implant, better circulation, gives a good amount of load of vitamins, minerals and prevent the neural tube defects and genetic complications. First trimester means from the beginning of the pregnancy up to the 3rd month of pregnancy. By improving circulation, nourishment and immunomodulation at chorionic plate. Pehle, first fetus is attached with the mother, first in the uterine wall, then develops chorionic plate and then it gets nourishment through chorionic villi. Chorionic villi means little bit grass like coming. And so I have just improving improving circulation and nourishment and immunomodulation at chorionic plate level, where fetus is directly attached to the mother, is a very simple chorionic plate. And chorionic plate, this can help in better nidations. मतलब कि आपकी जड़ें मजबूत हो जाएगी, वहाँ बच्चे की जड़ें मजबूत हो जाएगी. तो for better nidation, prevent recurrent pregnancy loss, जो बार बार बच्चा गिर जाता है तीसरे महीने पे, छठे महीने पे, या तो जो for prevention of damage, who damage, whatever the cause damage the chorionic plate, it will abort or it will give missed abortion. And we nowadays encounter at least 30% of first or second pregnancy of missed abortion or lots of cases. But by giving this, we can prevent this, the recurrent pregnancy loss and proper structure development of the fetus. And in second trimester means from 3rd month to 6th month. 6th month, second trimester fulfills the nutritional demand of the fetus and mother. Treatment of anemia, preeclampsia, oligohydramnios. Bottles of blood can be saved and better postpartum care with good lactation through this 3rd trimester. That means 7 and 9 months, bloods of bottle can be saved for better postpartum care with lactation. Evidences. I would like to give your evidences that a study conducted on effect of spirulina for its homeopathic efficacy for the rise of hemoglobin last trimester. Those who are having hemoglobin less than 9 gram percent, 90 to 95% cases did not require bottle of blood. Thank you. Another data are now collected. I am showing in the last 2 or 3 slides. By giving only spirulina, and no other hematinic given, and success rate is more than 90%. Those patient does not complain side effect except minor belching effects sometimes, and that can be tolerated by assurance and good cause and more benefits. Conclusions. In conclusions, pregnancy before 2008, before 2008, high risk cases of preeclampsia IUGR was 15 to 20%. Before 2008, my practice, and it drops down to 3 to 5%. 3 to 5%. You can imagine with the help of DXN products. And for the reference, I would like to quote here that my data, if you come across my delivery register, that last year, 2011, 426 deliveries conducted under Chiranjeevi Yojana supported by Gujarat government, means for the lower socio-economic status of the woman. We are enrolled with the Gujarat government this scheme, Chiranjeevi Yojana, free of cost, and we have given during antenatal period the spirulina. Out of 426, only 13 child was less than 2 kg. Only 13 child. That means my ratio is 3.5%. Under the lower socioeconomic conditions which I have conducted the trial, Chiranjeevi Yojana patients, those who are very, very irregular, uneducated and not coming regularly, and for these lower socioeconomic peoples, I have this Chiranjeevi Yojana. And for total my delivery conduction, this year I am going to conduct more than 1,000 delivery. my private patients and government patients, both are things. But I found lots of benefits with the help of this spirulina and ganoderma. So if we get fetal weight more than 2.5 kg or 2 kg, 3 kg, no or less incubator care required, better child survival, good inspiratory results are coming in thalassaemic children also. Due to its good hemopoietic efficacy, and spirulina also possesses ion chelating property with reference to the study conducted in 2008 that excessive ion induced oxidative stress was reduced. With the help of this reference, I am also started one study for the thalassemia major child, because our spirulina is very, very good hemopoietic. It provides raw material to the bone marrow, and it gives, though thalassemia major is a genetic disease, but it can be duration of the blood. Those children are requiring every 30 days blood bottle, can be increased up to 45 days, 50 days or 60 days. So we can save the bottle of blood by giving them spirulina more than if this way. And for that, on this 26th January, I have conducted a camp at Mahadev Gynec Hospital at my premises to enroll the thalassaemic children, and the data I have given free of spirulina to those children who are receiving blood bottle every month. And from 14th November, that is Bal Din of our Jawaharlal Nehru Chacha, I have started 3 cases, and I have enrolled 5 cases, and out of that, sir, I have got better result in 3 cases. One child was having 30 days blood transfusion. First of my Muhammad Hussain Firoz something tha, mere 50 kilometers away from coming to me, and Dr. Sajad Lakhani, my pediatrician, has given me chance to serve this child. On 14th November, he was requiring blood transfusion every 25 days. After giving blood transfusion, child come to me, relatives took to me, and I have given spirulina 1 TDS in the form of take this 90 capsules spirulina and report me after 90 days. His hemoglobin was 10.5, sir. And then I suggested that wait for further 10 days and come to me